I'm Dr. Christy Taylor, and I'm an internal medicine physician from Iowa. I've practiced for nearly 20 years. I started out in a physician-owned multi-specialty clinic, the Iowa Clinic, and I was their first chief quality officer. And then I was the chief medical officer McFarland Clinic, where we served both rural and urban patients. And throughout this time, I've also served as the medical director of a multi-state ACO. So in my career, I've been deeply involved in transitioning our organizations from fee-for-service to value-based care. I've been blessed to work at organizations that historically delivered exceptional care, but even we had to change our focus from that of volume to patient access and coordinating care to deliver the right care to the right patients at the right time. And now I'm the Chief Medical Officer of the Value Division of Clover Health, an organization which brings support and actionable patient information to primary care providers. So in all of these settings, a fundamental aspect we've focused on is the critical role of primary care providers in coordinating care. Patients who see primary care physicians absolutely have lower overall total cost of care. In my clinic, we focused on both patient access and engagement. We actually improved quality of care and had significantly lower costs, and we were successful in our value-based contracts. We received shared savings every single year. The most meaningful results, however, were what we saw in our patient outcomes, both in prevention and in disease management. And most of this work was done by primary care physicians. And then we collaborated with other groups around the country to share best practices and challenge ourselves further. Our preventative care increased, things such as vaccines and cancer screenings. And with actionable data and additional personnel, we managed chronic disease patients better, such as those with hypertension and diabetes, to help them get and stay in better control. This resulted in healthier patients and fewer ER and hospital admissions. But along the way to value, several investments were necessary. We added additional personnel such as care managers, plus the technological and analytical resources to make the data actionable. And these resources are outside the scope of what we would call traditional care or regular practice. For example, we put people and processes in place so that we could get real-time hospital discharge information so that we could reach out to patients during these vulnerable times in their health care. And it required both timely data and care managers in place to actually result in true care coordination so that we could have good follow-up, reduced medical error, and readmissions prevented. So across multiple organizations, I've seen the positive impact that primary care providers who actually focus on value have made. With the right resources, we have safer, better care at lower cost. But despite these successes, significant challenges remain, namely those of investment, administrative burden, and lack of predictability. Transforming care does require significant investment, which small or rural practices either can't afford or accomplish at their scale. There's just a base cost to personnel, and then the patient and analytic tools that you need are unaffordable for the small practices. But without these important solutions, we don't have the critical information that we need to better care for patients or avoid duplicate services. This is frankly what drew me to my work at Clover, so that we could work with primary care practices and provide them these additional resources so they could serve their patients. In the last several years, providers have experienced a drastic uptick in administrative burden beyond the good medical record keeping that you'd normally expect. There's additional reporting of information that's not impactful to patient care, and this burden is definitely heavier on the primary care physician. We're taking precious time away from patient care duties. Intentionally or not, we are adding strain to a shrinking primary care workforce. We must decrease the administrative burdens that are not directly impacting care. And finally, we need more predictability. Frequent changes in federal requirements and unstable payment arrangements are challenging for all providers, more so the smaller ones. In order for practices to be able to move to value and provide coordination beyond traditional care, we need predictable and sustainable reimbursement models. In summary, primary care providers are the front line of coordinating care. Patients who see primary care physicians are healthier and at a lower cost. We need to assist the primary care providers to enter and remain in value-based programs. Thank you very much.